District D.I.Khan is comprised of 1.3 million population and more than 75% of population are living in rural areas. The 28th of July was the most critical day in the history of this area when flash flood and torrential rains brought massive destruction for the whole district. According to UN OCHA, 26 out of total 47 Union Council were heavily damaged. 100 villages were inundated, standing crops were completely ruined, 172-kilometer roads were swept away, cattle were died, and almost 400,000 people had to leave their houses, and most of the mud houses were collapsed. People had to live in open air, and some of them availed the facility of tents. Sensing the level of destruction and helplessness of the inhabitants, various philanthropists, NGOs, and donors came up to help the flood affectees. Hamdam Development Organization is a local organization working for the last 16 years in District D.I.Khan and Tonk for the well-being and the capacity building of the people. Being the local organization, HDO carried out an assessment and felt the need to take initiatives in Union Council Mandra and UC Bhagwani Shumali. UC Mandra especially needs more attention and prompt response as it was situated on the bank of River Indus and most of its villages were completely submerged. The HDO shared the whole situation with International Development and Relief Foundation IDRF Canada. The IDRF positively replied to the call and the provision of hygiene promotion services to vulnerable families project started. The HDO male and female staff visited the area, met with the community and identified the activists who were willing to work for the relief activities. At first, 4 villages from UC Bhagwani Shumali and 7 from UC Mandra were identified. The selected villages were far away and no other organization visited these villages. It was not an easy job to reach out to these villages as the roads were totally swept away and there was no other communication ways. Wash committees were formed in the identified villages. These committees were comprised of the activists from among the affected communities and they had all the basic information of their areas and they were committed to support the people. With the support of wash committees, volunteers were identified for pre-cap survey. An orientation session was held with these volunteers and they were handed over the survey forms to get it filled from the community. After pre-cap survey, the registration process was initiated in target area. With the assistance of wash committees, the most vulnerable, orphans, widows, disabled, women and child-headed families, and old age persons were identified and registered. 200 families from UC Bhagwani Shumali and 300 families from UC Mandra were registered. When registration process was completed in both the UCs, the registered families were given token for distribution of hygiene kits among them. With the help of wash committees of respective area, a place for distribution was selected and on a given date, the wash committees provided volunteers to support distribution process. A hygiene kit consists of 1 water cooler, 1 bucket with lid, 15 soap bar, 12 laundry soap, 6 dishwashing detergent bars, 5 sanitary cloths for women and girls, 4 cotton rolls, 1 plastic lota, 4 towels, 3 toothpaste, 6 toothbrushes, 1 nail clipper, 2 combs, and 2 bottles of Dettol. The people were queued up, they were holding their tokens and in turn handed over the token and get their hygiene kit. The people expressed their gratitude after having hygiene kit.
We don't have anything and we need these things badly. It will make our life easy and clean.
We lost everything to flood. The hygiene kit will help us to keep ourselves clean. It contains some of the basic elements which make our life healthy. We will use these things.
The flash flood devastated the houses and all the available infrastructure of the government in target area. Schools and hospital buildings, and most importantly, the water resources destroyed. People were unable to get clean drinking water. Due to stagnant water and unavailability of sanitation facilities, people, especially women and children, were at risk for health hazards. Keeping in view the current situation and the observation of CAP survey, 40 health and hygiene sessions were planned in target villages. An orientation session of health and hygiene was held with hygiene promoters, in which they were shared with the agenda of health and hygiene session. Later on, the hygiene promoters hold the same session with target community with the support of wash committees. The flood affectees took keen interest in hand washing, personal, domestic and environmental cleanliness, threats from open defecation, methods of water purification, sanitation issues and how to tackle with these issues.
They have taken the session in which they shared with us that the cleanliness of homes and environment has great and positive impact on us. We will try to make ourselves and our village neat and clean to avoid diseases. We are thankful to the organization for giving this knowledge.
Through provision of hygiene promotion services to vulnerable families project, HDO managed to address some of the key issues of the target area. Mr. Abdul Ghafoor, the director of HDO, urged the need of more work in flood-hit areas as the people are very poor and they have limited or no resources.
Hamdam Development Organization took this project as a challenge. The level and magnitude of destruction was unbelievable. People were helpless and they need immediate support. When International Relief and Development Foundation Canada gave us go-ahead signal, HDO wasted no time. Initial assessment and identification of areas were made and community was mobilized. HDO believes in community participation as this motivating people to own whatever plan and implemented, and wash committees were a form of community participation. I personally visited the target villages and interacted with the community. They were thankful to IDRF who provided them hygiene kits. They also appreciated health and hygiene sessions. Through these sessions, they came to know some of the practical skills to make their lives disease-free. HDO, in collaboration with IDRF, initiated this project and successfully completed. We are really thankful to the management of IDRF for such support and cooperation.
Health and hygiene sessions and provision of hygiene kits help the target community to save their families from imminent threats of various diseases. Such kind of initiatives are the need of the time.